Hello, welcome back to my YouTube channel. In my previous video, I have discussed about neurotic disorders, and under neurotic disorders, phobic anxiety disorder was discussed. And in this video, we are going to discuss about generalized anxiety disorder and panic anxiety disorder. Now, before we could proceed, I would like to request you all to subscribe to my channel and please do share to others if you haven't subscribed. So, right away, let's move on to the topic anxiety disorders. Coming to anxiety disorders, last video I have defined anxiety disorders. Like I said, anxiety is a state of apprehension or an uneasiness which is created out of anticipation of danger or a fear of impending doom, maybe threat. So here we define anxiety disorders as a chronic condition characterized by excessive, persistent sense of apprehension. Here using this state of apprehension as persistence because the anxiety continues with these physical symptoms such as sweating, palpitation, and feeling of stress. Excessive or persistent sense of apprehension with the physical symptoms such as sweating, palpitation, and feeling of stress. Coming to anxiety disorder, generalized anxiety disorder, usually it is chronic. An anxiety which is unrealistic and excessive anxiety and worry. We can say this as a person who is having free floating anxiety. Free floating anxiety. In our families also we notice this one. Generalized anxiety disorders. Maybe we might be having our parents also where frequently they'll complain that they're having a lot of palpitations. For little sound also they'll tell I'm having a lot of tension. If some for small instance they tell I'm very much worried. Excessive worrying, lot of anxiety, thinking that some threat is going to happen, some danger is going to come somewhere. If sun goes out and comes very late at night or doesn't return on time, lot of fear and anxiety, too much when it goes beyond. And even for daily routine normal activities also, if there is some disturbance or delay, these persons will have anxiety. Free floating anxiety, that's why we call it a free floating anxiety. This word is used. This condition is called as generalized anxiety disorder, and a worry that is uncomfortable to a point of interfering with daily life. Because of this excessive worry and anxiety which is present in them, they cannot carry out with their daily living activities. A person with GAD worries excessively and feels highly anxious at least 50% of the time for 6 months or more. This is a criteria where we can categorize a person into generalized anxiety disorder. 50% in a day, 50% of the time the person will be highly anxious, and if this anxiousness is being present in the person for 6 months or more, then we can categorize them as suffering with what? Generalized anxiety disorder. Now, some of the signs and symptoms of generalized anxiety disorder. Psychosocial symptoms. Difficulty handling uncertainty. Feeling restlessness, indecisiveness, fear of making wrong decisions, difficulty concentrating. These are some psychosocial symptoms. Coming to physical signs, you all know tremors, weakness, irritability, heart rate increases, muscle ache, body aches, nervousness, cannot sleep, trouble sleeping, sweating, nausea, numbness. These are all physical signs. Then they have difficulty in handling uncertainty, it's there, almost present. Coming to the course, it is characterized by insidious onset in third decade, 30 years, and usually runs as a chronic course. From that age, usually onset at the age of 30 years, and this is present throughout their lifetime, chronic course. At times it get exacerbated and sometimes it is in a settled form, but most of the time 50% of it is present for 6 months. Then we categorize as generalized anxiety disorder. Treatment for generalized anxiety disorder is medications. We said anxiolytics can be administered. Under that we said benzodiazepines. For panic anxiety, remember, do you remember? We said benzodiazepines, antidepressants, and beta blockers, same thing. And different forms of psychotherapies can be given. Self-help like meditation and relaxation can be done. Next, coming to panic disorder, panic anxiety disorder. Panic disorder is also characterized by presence of anxiety which is intermittent, unrelated to particular circumstances. Though anxiety is intermittent, it only occurs in particular situations. The central feature of occurrence of panic attacks, sudden attacks of anxiety in which physical symptoms predominate, such as like person is having hyperventilation, choking, chest pain, and severe sweating, confusion, not able to concentrate, restlessness, instability of mind. It's present, panicking situation. And lifetime prevalence of such disorder is 1.5 to 2%, and it is more in females. We said 2 to 3 times more in females. Actually, when we have seen about neurotic conditions, we said like more common in females. Some of the signs, some of the symptoms of panic disorder in detail, if you just see here, same thing like generalized anxiety disorder, some are present, but here we have hyperventilation, choking, chest pain. So tingling and numbness, nausea, abdominal pain, fear of death, as if though the person is going to die, feeling detached from oneself, fear of insanity or losing control, shortness of breath or smothering sensations, dizziness, lightheadedness, giddiness or fainting attacks, trembling, shivering, shaking, chest pain, rapid heart rate and palpitations. When we use this word panic, I think you know mild, moderate, severe. Next comes panic anxiety. Etiology of anxiety disorders in both generalized anxiety disorder as well as panic anxiety disorder. Coming to genetic theory, it is more frequent among relatives of patients with this condition than 15 to 20% of the first degree relatives. Next, coming to monozygotic twins, 80% concordance rate is seen. Coming to biochemical factors, alteration in GABA. What is meant by GABA? GABA is a neurotransmitter. If you just look back, I said gamma aminobutyric acid may lead to the production of clinical anxiety. So alteration, when we say mostly decreased level of GABA. Gabapentin, gamma aminobutyric acid, it is a neurotransmitter and it is an inhibitory neurotransmitter. So when an inhibitory neurotransmitter is less, definitely it produces a lot of anxiety. Next, according to psychodynamic theory, so I have been repeating this psychodynamic theory. You can think of a person, important person, Sigmund Freud. According to this theory, we said three types of defense mechanisms are used. First one is suppression, repression, and displacement. In this GAD and panic anxiety, person tries to use repression and this defense mechanism fails to function adequately. As a result of this, lot of anxiety is produced. When repression, this defense mechanism fails to function adequately in a person, anxiety is produced. Next, coming to behavioral theory, I have explained regarding these behavioral theories in detail in my previous video related to neurotic conditions. Please go through that video. We said like unconditioned response and for unconditioned stimulus, and that unconditioned stimulus will bring about a conditioned stimulus and it will bring about conditioned response. Now regarding cognitive theory also, you go back and see my previous video please. So we said negative, automatic negative thoughts or negative perceptions or cognitive distortions, imaginations, perceptions. When a trigger is very small, the way we think, the way we perceive or imagine situations, when they are beyond or they are negative and there is like exaggeration of our imaginations, we call it a distortions, then definitely the person is going to end up into anxiety. Treatment for GAD and panic attacks, we said benzodiazepines. I have mentioned in my previous video some of the benzodiazepines, like we call them as mild tranquilizers, hypnosedatives. So we have clonazepam, alprazolam, diazepam, lorazepam, etc. Then antidepressants for panic disorder. We have TCAs, SSRIs, gabapentin. These drugs, amitriptyline and other drugs are also there, mipramine, clomipramine, etc. Then we have beta blockers which are used for controlling palpitations. They respond. So propranolol, I said, etinolol, yes, metoprolol, we have timolol. These are all different drugs which are given to treat generalized anxiety disorder and panic anxiety disorder. Coming to the behavioral therapies, we have discussed about flooding, systematic desensitization, then exposure and response prevention for phobic anxiety disorders, because exposure and response prevention is something that when we expose to phobia, systematic desensitization. But here in behavioral therapies we use biofeedback. Biofeedback is a mind body technique where which involves visual as well as auditory feedback to gain control over involuntary body functions. Now in GAD we said there are presence of palpitations, tremors, heart rate will increase, respiratory rate will increase, so muscle tension is present, blood pressure also will increase. So hyperventilation symptoms are present where we attach this equipment, blood pressure, and ask the person to just note their observations physically, then ask them to relax. Then when they use this relaxation and meditation, how they can control themselves and how they can reduce their anxiety. Then other psychological therapies like relaxation therapies is progressive muscle relaxation therapy, and yoga, pranayama, that is meditation. Pranayama is focusing on our breathing mainly, and self hypnosis also. These are like mind-based therapies where we can suggest to a person who are suffering with these anxiety disorders. Coming to nursing management, we need to assess, as mentioned, physical symptoms which are present in the person. We have seen in signs and symptoms, and psychological factors where their attention is disturbed, concentration is disturbed, then orientation also. Then regarding the social data we have to see, and specific symptoms should be noted to along with the statements made by the client about subjective distress. The nurse must use clinical judgment to determine the level of anxiety. I said it might be mild anxiety, moderate anxiety, severe anxiety, or panic anxiety. Coming to nursing diagnosis, panic anxiety related to real or perceived threat to biological integrity or self-concept. When we say biological integrity, it is related to physical aspects, evidenced by physical and psychological manifestations, symptoms which are present. Next, coming to powerness related to impaired cognition, evidenced by verbal expression of lack of control over life situations, and non-participation in decision making related to own care or significant life issues. Some of the interventions. In my previous video related to neurosis, we have seen, I have discussed about some of the nursing interventions we can use. But here, in addition to that, we can stay with the patient, offer reassurance and security. First, we have to assess the mental status of a person. Maintain calm, non-threatening matter of fact approach. Use simple, clear, concise statements to the person. Brief messages. See that the surrounding environment is kept at a low level of stimulus. Very few people, dim lights, administer tranquilizers as prescribed by the physician. When the level of anxiety in the person reduces, then we need to explore from the person the reasons why they are having these panic attacks or why they are having generalized anxiety, and teach them how to reduce the anxiety by teaching them regarding relaxation techniques like progressive relaxation technique, there is instant relaxation technique, deep breathing exercises, meditation, physical exercises also. The nursing interventions to improve self-control in anxious patients. Assess the mental status examination of the person. Allow the patient to take as much as responsibility as possible regarding their self-care activities. And when they do take care of their self-care activities, you can provide positive reinforcement and positive feedback for whatever they have attempted. Set realistic goals for the patient. Identify life situations that are within patient's control. Definitely not everything is in control for us as we are humans. There might be some situations which go out of control, but we need to help the patient to identify situations which are within his or her control. Then help the patient identify areas of life situation that are not within his or her ability to control. Encourage verbalization of feelings on one-to-one basis. So these are certain nursing interventions we may use. Administration of medications as prescribed. I hope you understood these two conditions: generalized anxiety disorder and phobic anxiety disorder. And if you have any doubts and if you want me to just go in detail, or if you are not having any clarity in some of these areas, you may use comment box. I'll be looking at the comment box and I will respond to you. So before ending this video, I hope you have understood this. Thank you all very much for listening. I hope This will be useful, and please don't forget to subscribe and share to others. Bye for now, and we'll meet pretty soon. Thank you all once again.